Hello, and thank you for joining me today. I'm excited to discuss a fascinating prospective material for use in pre-prosthetic surgery. Periodontal disease, or post-extraction reabsorption, can result in insufficient bone volume for implant integration or periodontal aesthetics. Alveolar bone grafts are indicated in these cases, and a variety of methods and materials are available to accomplish this. The patient's own bone, transplanted from their jaw or other areas, can be used and is referred to as an autograft. This is recognized as the gold standard because of its high rate of success, but has the drawback of an additional invasive surgery and often painful patient recovery. Alternatives arose that show clinically satisfactory results, such as using donated cadaver bone, which is called an allograft, animal-derived bone, called a xenograft, or synthetic inorganic materials, called an alloplast. These options are more convenient and comfortable for the patient. Allografts and xenografts, however, carry albeit low risks of secondary infection and immune rejection. Patients may also have ethical or religious concerns with the use of cadavers or certain animal species. Alloplasts or synthetic materials do not have these drawbacks, but lack osteoinductive properties of the other graft materials because they do not contain necessary proteins or growth factors. This creates a need for an alternative material with excellent clinical results and without the drawbacks of other traditional methods. Autologous particulate dentin grafts may meet that need, all while being a more economic choice. Tooth extraction often precedes implant placement, and dentin grafts are prepared from the patient's own extracted tooth through the following process. Soft tissue and restorative materials are removed. The tooth is ground into particulate form, which is then rinsed with a cleansing solution to eliminate pathogens. The particulate can then be used immediately or stored for future use. Our team is currently conducting a scoping review of the literature that compares APD grafts to traditional grafting materials. Following PRISMA guidelines, we aim to see how APD grafts compare across parameters such as reabsorption, implant integration, and histomorphometry. Our initial findings suggest promising advantages for dentin grafts in terms of biocompatibility and clinical success rates. Based on our initial search, we maintain our hypothesis that dentin grafts are a viable alternative to traditional grafting methods. In summary, dentin grafts represent a compelling option for implant prosthetic surgeries. Utilizing the patient's own tissues, we can reduce risks, improve outcomes, lower costs, maintain cultural sensitivity, and ultimately improve outcomes for provider and patient. Thank you for your time and attention. We look forward to sharing our complete results upon completion of our review. Thank you.